Wait for a while.
Yes.
We're going live in YouTube.
No problem.
In my channel. But
I'm searching that only.
okay. Okay, you can go on.
Is it
Go
live?
on. Yes.
Okay. Great. So, yeah. So again, this was a case of 1-year-old kid, and he had convulsions every day with constipation, history of pneumonia, and now his mother is saying that he has sudden movements of different parts of the body, like a twitch or a cramp. They didn't understand exactly, but I felt that the way they described it was a kind of a twitching, sudden movement. Sometimes it happens on one side and sometimes on both sides, but mostly they saw that it's on only one side of the body. If it is right, only on the right side, or left, only on the left side, and sometimes both the sides, but it's not fixed. So that was a narrative from the mother. And when I asked about the nature of a child, then she said, "He's very naughty, doctor. Please do something. He can do anything. He is only 1 year old, but he would throw stones at dogs. He would just pull the tail of the dog, or even sometimes he will go behind the lizards or dogs or any animal, and he would make them run away. So he don't fear anyone or anything. He's very, very dominating. We have to do whatever he wants. And though he's very small, but he loved doing pranks with others. So if he tricks someone, he will like it. It's like the most important joy of his life, and we are really worried about this because right now people say he's cute, but what will happen, if he keep doing it when he grows? So I said, okay, tell me more about it. He said, if if someone falls down or something like that happens, he will laugh and enjoy. He will laugh like anything. If any such things happened, he would definitely enjoy that. So he would enjoy if people are in pain or people are struggling to do something. If his friends in the neighborhood, he will go and he'll play with small kids. And if his friends in the neighborhood or his cousins are teasing, so sorry for the spelling mistake, it's teasing. So if they tease him, he would slap them, he would kick them. He's very violent in that way. He's not a very cute guy. He is naughty, and at the same time he tricks people, and he does the pranks. I was so surprised because he is only 1 year old. And then the mother said he wouldn't think twice. Directly, he would hit people. He would hit his grandmother, me, his father, even older kids. He is like, he's very smart. He would just kick them and go away from them. He's a smart kid, very tricky to handle. And if anything happens or he has done something wrong, he would come to us and he would make a very naive puppy face. So I feel that he tries to play a victim card with us. And then we have to cuddle him, we have to love him, we have to, provide him the comfort. Otherwise, he would be a very weirdly. Okay. So basically, he's a very smart player. That is what the mother said. So in totality, we have few things. So we are dealing with a case of a convulsion or chorea, abnormal movements, constipation, which is very hard every third day, and if you see, there is a lot of periodicity in complaints. See, stool is happening every third day, scissor is happening on Delhi on the same time. Okay, so and cold and cough also every change of weather. So there are periodicity of the complaints. So periodicity everywhere in the scissor, in the constipation, cold and cough, etc. And we can see how smart he is, how cunning he is in a way. because he would laugh at people if people are in pain, if they are falling down, if he could make the dogs run away, he will pull. And a lot of like cunningness is there, and very tricky to handle, very very naughty. So this is one tip I want to give you whenever you are handling pediatric cases. And if a mother says, my child is very naughty, please ask them what exactly he does. Naughty is not a symptom for us, okay? What exactly the child behaves or what exactly child does is more important than saying naughty. Because naughty can have so many meanings with it depending upon parents, and parents won't tell you that my child is jealous and cunning because it's child to them. But we need to understand being a physician. So I wanted a remedy from animal kingdom belonging to spider subgroup because it covers all the features of spider. So Dr. Sakina is already suggesting tarantula, and I highly appreciate it. But let's understand the spider group first, and then I will tell you the remedy. So that was a case. So spiders, why I went to spiders? Okay, that I will tell you. So spider belongs to the arthropods, and in arthropoda you have insects, scorpions, ticks and mites, and spiders, like all of them. Okay, so let's see what are the spider expression and patience. So if you will see spiders, they have very intensely paced animals. They have to act fast because one thing is their lifespan is short, and they have to do every activity in that short lifespan only. They don't have years to live like mammals like us, because in humans I always say that we spend 25, 30 years in education, another 20, 25 years in doing chores, in job or career or anything, in love and marriage, and then another 20 years for kids or their future, and then we retire and do something else. So we have a lot of time to do everything. But it's not same with spiders and insects. That is what you need to understand, and why they are so speedy. Insects are also same because sudden death is there. They can die anytime, so they have a short lifespan and they have to do everything. They have to reproduce, they have to live their life, enjoy, eat, excrete, sleep, everything. We sleep for 8 hours because we have 24 hours day and so many years to live. It's not same with other animals, especially spiders and insects. So first thing is spiders are intense paced, speedy, hyperactive, very busy people. They have quick and constant movement because you know otherwise they won't survive, because they have so many animals. They have enemies in the air, on the earth, and otherwise also in the water as well. So you have to fight with those animals and survive in the same world. So you have to be very very quick to be able to live for longer. They are active wanderers. They have a very important pattern or periodicity or rhythm in their life. So their movements are very very rhythmic, short lifespan, very attention seeking, because reproduction is also very fast, and they are very sexual. If you see the behavior of spiders
Sorry, there is question.
yeah, okay.
How they know from Kashria Prajuguru? How they know they have very less time to live?
How they know? So every animal knows that. So we see they are not dumb, stupid people, right? Stupid animals. They can see that they don't have that much of time as a species. See how mammals know that. We can see other people dying at the age of 60, 70, 80, 100, whatever it is. So we observe. So and that's why as a species you have some characteristics ingrained inside you, isn't it?
Yes,
Okay.
agree.
So So that's the reason. They are very mischievous people because mischief actually helps them to stay alive. We are only talking about the spider animals, okay? And that's how it comes to spider patients. Needing the spider remedies. They are mischievous. They attract dance and music. We know that how important it is for them because they have to attract the mates and then they have to reproduce with them. So dance, music, rhythmicity, pattern, colors, it's very, very important for them because of high sexuality. And their vision, most of the spiders, they don't have very good vision, but they have very good tactile sense. So they can sense the vibrations because and that's a gift of nature to them that they weave beautiful webs, and those webs are sometimes they help in various ways. The web is web helps them to capture the insect, so capture their food, also in traveling, also in in providing them the security, in providing them that safety which they need for survival. So vibration is a way of nature to tell them that you have a threat, so they can sense the vibrations. And that's why I'll tell you, most of spider remedies have some problem with either noise or physical touch. They don't like hugging, cuddling, kissing and all that from all the people. If you will go to a spider patient, who needs a spider remedy, he won't like you touching him regularly. It's not that, because they can sense the vibrations and they don't like it. Very sensitive to temperature changes. And we know about the webs. They weave the beautiful webs and leaf trail. So, Dr. Dana, you were asking that they are sensitive to temperatures. Yes, they are very sensitive to temperature, and they have to be sensitive because they live in burrows and on trees, on the curls of the leaf. So if suppose temperature and weather changes, they will be affected by it, and that's why. And their physical sensitivity is very, very high. That's why they get affected. So different spiders have different effects of temperature and weather. You have to read that particular remedy, and you'll get to know that what is the effect of particular temperature on particular spider. But definitely they are very, very sensitive to the change. They are sudden and impulsive. Welcome. Sudden urges, short bursts, sudden death, sudden fear of death, and very, very impulsive because they are not very smart like snakes. And also they have their their fangs, their this poisonous, what I should say, they can secrete this fluid which is very poisonous and toxic. So they are very impulsive to and impulsive for the violence. They are very aggressive also. In snakes, you will see they are not that, they are aggressive and violent, but not impulsively. They will plan. So there will be a lot of planning, plotting, waiting. Spiders are not like that. They will do whatever they think is right. And specifically in children, you can see this very, very beautifully. They are very impulsive and do not think before acting. uh, Suppose in this case also, the mother told us that he is very naughty and he doesn't think. We have to do everything he wants, otherwise he will behave very weirdly. So there is a lot of suddenness in this case also, and in the movements are also sudden. So this is a type of attack and defense in spiders. They feel caught and trapped. Burrowing is a very important characteristic. Deceit is important for their survival. That's why they're very deceitful. Pretense, feigning, disguise. Because sometimes when the enemy is there, when the predator is there, they will pretend to be dead. They will disguise them. Camouflaging, that's very important. They can change their color and just blend with the atmosphere. Very cunning people. Camouflaging, hide, kill and hide, ambush attack, pursuit, running and biting. They are very important features of spider group. So these are some human expressions like cheating, fabricating, scamming, cheat, tricky, fraud, forge, imitate, mimicry, pretend, feign, deceive, hoax, imposter, trap, practical jokes. Like this mother told, no? Though he is 1 year old, but he would prank with people. He loves that, and he will laugh if people are having pain. So that is how they are interested into practical jokes. At this point of time, I remember one of my uh, senior, unfortunately, the senior of mine did a prank with one of my classmates or junior. I don't remember exactly, but what he does is, what he did is that he kept a tube light over the door of the washroom, and he just wanted to frighten this younger junior as a part of ragging, of course. And when this junior just entered into the washroom, this tube light fall down on his head, and it broke down, and it was a big fuss in my college. So so people doing these type of practical jokes or pranks, which can cause pain to someone, and they are so impulsive, they don't think twice before doing it. But this is just to make you understand that what kind of people these are. They lie in wait, ambush attack, tripping is one quality, entangled, they might talk about entangled or tangled, sticky webs, pull web over the prey, smells. So they are very attracted with the nice smell, because that helps them to attract. They run around round and entangle, and that's kind of hobby for them. And also they are interested into this tangling, untangling, because of the attraction towards the web and weaving. So this is a mnemonic which I have learned from Dr. Shankaran, and I really like this mnemonic, which exactly describes the spider. So spiders are small, speedy, sudden. They are pursued, paralyzed, and punishing, irritable, impulsive, D for deceit, destructive, death, E for excite, ensnare, and escape, and R for restless, rhythm, and rage. So it has everything, every quality of the spider. You can just, click a picture of this, or just note down in your diary, so that you understand and you remember what spider is all about. This is this is the entire summary of spider, nothing else. So now, again, let's come to the case. What do you think, which remedy I gave?
Migale,
Which one?
migale.
Mygale, Mygale. Yes, you're right. Absolutely correct. So I gave Mygale or Mygale Lasiodora. This is the remedy, and let's read it. Yes, you are absolutely correct. So Pulford says, so this is the remedy. This is remedy for chorea or convulsions. So it's a less proved remedy, I'll tell you. This is not a very well known remedy among spiders. Most of people think about the tarantula. One of you also, Dr. Sakina, you told about tarantula, and I'll tell you why we think only about tarantula, because we don't know other remedies. This is one thing. And second thing, tarantula is one remedy which is very well proved. So it is a signature remedy for spider growth. So if you understand tarantula, and whenever you are thinking tarantula for some case, my sincere suggestion to all of you is think about other spiders as well, because we can see only what our mind knows. We don't know about other spiders, and that's why we don't prescribe. Yeah, so Mygale, I reached to Mygale because I knew that I wanted to give spiders, but I didn't know which spider. Okay, and there was no dancing and like for music and all those things, which is very very important to prescribe tarantula. Okay, so I'm sure I didn't want tarantula, and tarantula doesn't have that much of chorea and convulsion. It has the twitchings and spasms, but tarantula has other peculiar symptoms which were missing in this case. That's why I read all the spiders, and then I decided to give this one. Okay.
Yeah, migale.
Yes, Migale. So it is low spirited, depressed, has a dull pain in the head often jerked to one side, the muscles of the face twitch constantly. So this mother was trying to tell me that it is a irregular movement, and she was not sure whether it was a, it was a chorea or not, or convulsion or not. But she said it is, irregular movement and constant motion. So muscles of the face twitch constantly, grits the teeth at night. The words are jerked out in the effort to talk. Even the words are jerked out. Imagine how beautifully our masters have written. The muscles of the arms and legs become convulsive and uncontrollable, and muscles of one arm and one leg, usually the right, twitch and jerk, cannot keep the hands in one position for a minute, but the limbs are quiet during sleep. So, clinically, this is a proved remedy for chorea. Okay, and let's read it from other books as well. So I try to confirm it from different aspects, not only from
There is
sensation.
question, how do you reach Miguel?
Yeah, that is what I
There is a
answered.
question, how
Yeah, so I reached because I knew that I didn't want to give tarantula because the peculiar symptoms were not there. Then I read all the possible remedies in spider group, and then I reached to Miguel because I wanted a remedy for the chief complaint, which was chorea. So after reading only, I decided this. Okay. And I tried to confirm or verify the remedy from other aspects like constipation and this excessive thirst. This is not there in other spiders. You will see they have poor appetite. So poor appetite is a common to all the spiders because they have to, stay very light footed so that they can act. So all the animals which are lighter in weight and which are very fast, you will see their eating habits are very frequent and small. So because if you eat too much, you won't be able to move a lot. So for that speed, to attain that speed, you have to eat less. That's the reason behind eating less. So they have aversion to food. And the mother said, he drinks a lot, but he doesn't eat. So this is a confirmatory symptom of megalia. Unsteady gait, see how beautifully Boric wrote. Constant motion of whole body, tremulous, intense redness in streaks, twitching of the limbs, restless hands, convulsive, uncontrollable movements of arms and legs, limbs drag while walking. And Fatak says the chief clinical use of this spider poison is in chorea, especially of upper parts. And this boy also had upper part of the body, chorea of upper parts, twitching and contractions of facial muscles and hair, which is jerked to the right side. This I couldn't confirm in the case that he had right-sided jerks, but he had all over. Mouth and eyes open in rapid succession. Words are jerked out in effort to talk. Nausea with palpitation and dim vision, and unsteady gait and convulsive, uncontrollable movements of arms and legs. See, Nash says, this is, I really like the way Nash wrote that this remedy also ought to be fully proven. So he says we have to prove it, in fully, and we should understand more symptoms from this remedy. So Miguel or Miguel, I gave in 1 one dose once in fortnight initially, and later I gave when he got better. I gave in a monthly basis maybe. Okay. So this is a follow-up. I have just summarized the follow-up because I have so many follow-ups. So I just try to summarize. Within 3 months, the chorea reduced by 60%. Convulsions reduced by 60%. It was not on a regular basis, once in a week or once in a fortnight kind of. So periodicity got broken. Okay, they stopped the anti-convulsant drugs because he was on this anti-convulsion drugs, which was given to him when he was 6 months old. So they stopped within 3 months, which was a great relief for me because I'm telling you, by my practical experience, it's very difficult to stop those drugs. Patient becomes totally dependent on them, and as soon as you stop, the convulsion comes again because of withdrawal and not because of the disease. So we have to understand the disease symptoms and the withdrawal symptoms. Okay, so 3 months we stopped it. It was a great relief. After 8 months, baby was much better. He started eating properly, which he was not doing earlier, and no convulsions from last 2 months. So I'm not saying that he did not have the convulsions, but it was way lesser than before. Okay, so only once in before this, once or twice in almost 6 months, and no convulsions from last 2 months when I took the case after 8 months. I treated him for uh, almost 2 years, not exactly 2 years. After 1.5 years, baby better. Convulsion occurred only once in last 6 months without anticonvulsion drugs. And I treated him for almost 2 years. When he was 3 or something, we stopped. They stopped the treatment, and I know their family right now also. They are quite good. Baby doesn't have any problem. So it helped him a lot. So understand what is this remedy. This is a large Cuban spider, and I'll tell you biologically, it's a kind of sister remedy of tarantula. It's very close to the tarantula. It's from the same subfamily. So sometimes looks like a tarantula, but it has very specific chorea symptoms, the convulsion symptoms. It's mostly for chorea, twitchings, no appetite, thirst, huge thirst, almost like a arsenic or bryonia thirst. Restless, very cunning, tricky, and chilliness is one thing which you will see in most of the spiders, but in Mygale, it's very clear. Chilliness. So these are some themes of spiders. They are very active, restless, busy, and fruitlessly busy, complaining, they lament a lot. Dyskinesia is one feature which you always should remember while understanding spider, because they have very irregular body shape and movements, and these movements are normal for spider animals because it helps them in living. But if it comes to to patients, to persons, it becomes a problem. So jerking, involuntary movement, and it's more in ground dwelling spiders. They refuses eat, very poor eaters, and they want light food, just like juices um, or something like fruits, or people who talk so much about eating light food and not eating much and oily food. And mostly they are not Indians, because Indian love the heavier foods and all the spicy ones. We as a general theme, I'm telling you, we definitely like the heavier foods. Hurry, very hurried. Yeah, fleshy juicy fruits. Yeah. So all these people who are eating strawberries and lychees and juices, they might need spider remedies. I'm not saying they are the only ones, but definitely they will love light foods. So hurried, very strong rhythmic music they like. And colors, they are attracted to the fluorescent colors mostly. And dancing is one of the feature. You will see this dancing in most of the spiders. Okay, but the most prominent spider is tarantula. Persecution, hypochondriasis. Okay, the don't like touch feeling, that because they have very high sensitivity towards the touch, highly sensitive nervous system. So whole nervous system is very sensitive, so they can't bear the touch, the sound, the pain. If they have this much of pain, they will tell you this much of pain. So they won't be able to suffer with that. They won't be able to take it. They will tell you, oh my god, this is happening to me, that is happening to me, what should I do? Yes.
Lalika tarantula's fear of action is not convulsions as in Nigale, that's why.
Yes, true. And also I'll tell you one question I saw, that how to differentiate tarantula and tuberculinum, I guess. Yeah. So I'll tell you, tuberculinum children are very outgoing. They love traveling. They love going out. And I'll tell you, a practical difference is tuberculinum children are very constructive. Tarantula children are very destructive. So naughtiness is little different. Here tarantula want to break, want to make the pranks and all that. Tuberculinums are not like that. Tuberculinum will not break things. They will do something. So they are, of course, and they want changeability, which is not there in tarantula. Tuberculinum is all about, playing with one toy for 15 minutes, getting bored, playing for another toy for 15 minutes, getting bored, and then I want something else. So it's like a kind of creative naughtiness and not a destructive one. In tarantula, they are very cunning. You'll get to know. So increased sexual desire and sexuality, you will see feeling of danger, possibility of death, trapped, caught, killed, cunningness, secrecy, you will see deceit and crime, and sensitive to human interactions. And they also might feel outcast or rejected by the group, irresolution, and mostly you'll see tuberculonism because of the fast, speedy activity. So they are like disobedient, rebellion, and they fear narrow places because they can die in narrow places. Mostly they live in such places. So that's why they have very strong fear of narrow places. And stinging pains, strong desire to drink, and even food they want in liquid form. Okay, and tobacco ameliorates them, most of the spiders. That's all. So I hope it helped you. If you have any questions, just let me know. Related to case or related to spiders.
Thank you very much, Yamini. It was very interesting. We'll learn more about spiders. And now, Jyoti, let me find you. The next speaker is Dr. Jyoti. Let me find you. Dr. Jyoti, can you say me hello to find you? I can't find her. Dr. Jyoti cannot find you. Ah, probably I found you. Dr. Jyoti, I promoted you to panelist, so can you now? I made you co-host now. Thank you. And you see how good result.
Can you hear me?
Yes, only waiting for your camera.
Yeah. You have to, I think, you have to allow. You are not allowing.
Fakusi, wait.
Host has stopped it. It says host has stopped it.
Try now.
Yeah. Hi.
Yeah.
Me?
Hi,
Yeah.
nice to see you. Present yourself.
Yeah.
For 1 minute, who you are.
Yeah. Can you see me?
Yes, we can see you perfectly. You can start.
Yeah. what I will do is, yeah. Can we start?
What?
Genova? Can we start?
What?
Can I start my presentation?
Yes, I can. Yes, yes. Ah, you want me to change the slides?
No, I will do myself, but can you see my
I can
presentation?
see your presentation.
Yeah. This is case of
Yes, everything is
45-year
perfect.
female.
Go on.
Patient female, 45
Okay.
years old. Give me a minute.
Yes, we lost. Okay.
Yeah. Chief complaints. Discharge from right ear since 20 years. Headache since 10 years. Irritable bowel syndrome since 5 years. She is on psychiatric treatment for depression since lockdown, that is since last year. Discharge from right ear since 20 years. Watery every day, sometimes bloody or with pus. All started after my husband slapped me 20 years back. My hearing is also reduced. I took medicines, it didn't help. Then I underwent surgery. Discharge stopped. Again, 3 years back, my husband slapped. Discharge started. First bloody, then took antibiotics. Since then, not stopped either pus or blood or watery discharge. Surgery can't be done because already it is done once. Headache, she said it is a stress headache. Whenever I get stresses, fight with my husband, I will get it. Pain whole head. Pain as if my husband is sitting on my head. Dull aching pain. Nothing helps me. I will have lot of anger whenever I get headache. I shout and scream when I have headache. Nothing helps. 2 to 3 days I will have pain. Then gradually it comes down. My intestine is not good. I have to pass stools whenever I eat. I pass 8 to 10 times daily, usually with blood. Doctors did colonoscopy and they said it is irritable bowel syndrome and it is because of stress. When I take medicines, I am better. Some problem, that is stress. For her problem is always stress. I'll get back my problem. I am on psychiatric treatment. I developed depression once lockdown announced. I was very happy going to office. Not going out was like punishment given by my husband. I developed suicidal tendency. Wanted to ram my car, to big trees. After medicines, she is on allopathic medicines. I am better. What must be reason for all your problems? That was my question. I asked her. Once she told, I allowed her to tell all her problems. Then I asked her, okay, what must be the reason? She said, Doctor, stress. My big problem is stress. All my problem starts because I have a stress. My husband is a big stress for me. I stay in UK. He thinks no relatives will come there and he can do whatever he wants. He can do. He doesn't want me to go to office. He made me pregnant thrice so that I can stay at home. He is very suspicious. He makes me angry all the time. He is so disorganized. What you do when you are angry? I want to slap him back. I want to break things. I don't do, as things in US are very expensive. I tell him, what if I hit back or answer back you to the husband? Give respect and take respect. He is a dirty man. When we are arguing, he suddenly attacks me. It takes me some time to understand. He degrades my body parts, my hearing problems, because she has told me, no, I can't hear properly. Fears, I have a great fear of snakes. Even if I think of snake, I get palpitation and breathlessness. I don't like to see picture of snakes. Even snake pattern on clothes, leather items of snake like shoes and bags, I can't see. Even something comes in TV, I'll run away. If something of snake, comes in TV, she will run away. I have a phobia of closed places like MRI scans. I had attack inside when I went for MRI scan 2 years back. Dreams. I dream of my mother-in-law fighting with me always. Only in dreams I talk back. Otherwise, I don't talk back because my husband hits me. Dreams of black snakes. I feel suffocated in the sleep when I see snakes. I see ghosts. I speak to the ghost. I fight and argue with them. What else? I love small dogs. They are lot of love. I hate cats as they have an attitude. I am a peacock in the zoo. And my husband is poisonous, toxic snake in the same zoo who needs to be kept in cage. Otherwise, he attacks me, the lovely peacock. See the imagination where all patients go. If you allow them to talk, they take you to everywhere. Doctor, at the end, she told me, Doctor, I forgot to tell you. I had too much of bleeding immediately after my second delivery. With great difficulty, it was stopped. Chalo, okay. Yeah. Can you see, Genova, my PPTs?
Yeah, yeah, I'm trying. I wait.
No, can you see my PPTs?
No, I wait. I switched off. I pushed some button and lost it. Ah, yes, it came. Yeah, now it's all right. Sorry.
No problem. So,
I enlarged your face because I wanted to see you bigger and then push some button and lost
it is okay. I am reading what is there in the PPTs. So it is okay if you cannot see the PPTs also.
Sorry.
So with great difficulty, it stopped and I had lot of bleeding after second delivery. So my analysis of this case is discharges, hemorrhagic tendencies, stress, reason for most of the complaints, husband and mother-in-law are enemies, wants to be out so that I am out of stress, angry, anxiety towards sudden attacks, fear and dreams of snakes. Kingdom analysis, survival, competition, victim and aggressor, me versus husband lead to animal kingdom. Whatever complaint she is talking about, she comes to husband and his attacks. Someone is causing something, me versus others, husband or mother-in-law. Animal kingdom, victim and aggressor, split within self, me versus others, issue of survival, reaction, I need to submit or overcome. Sensation, the fear of being They did it to us, I will get them. When we talk kingdom analysis, in homeopathy practice so far, we have used symptoms as the only guide to the selection of remedy without really considering the source of the drug. To me, like to many classical homeopaths, the symptomology of any drug is intimately related to the source it is drawn from, and that each drug has it in the essence of the source. Our remedies, whether they come from plant, animal, or mineral sources, each represents the spirit of that source and must have the character of that source. I have attempted to identify and note down the main differentiating feature of the major kingdom from where our medicines are derived. So after that animal kingdom, I have come to the subkingdom, which is reptiles, come out again and gain warmth. They have a conflict in them between being seen to come out, being visible versus being hidden. Reptiles are very extremely careful of their surroundings. Careful, watchful, vigilant, and guarded. Two facets. One side is very nice and other side is violent and destructive. Suddenness, sudden burst of activity from a position of absolute inactivity. Reptiles, in that reptiles escape and hide, feeling of being at a disadvantage. Escapism is incompetence for face-to-face fight. Reptiles attack only when repeatedly provoked or cornered. Keywords: sudden, violence, bright colors, little or minimal parental care, swallowing things as a whole, need to be strong, tough, and aggressive. In reptiles, it is snakes. Snake's mode of attack is either poisoning or squeezing, and then swallowing the victim as a whole. Ability to survive without any limbs, crawling, swim, etc. Shedding or molting of the skin as a whole. Highly flexible jaw movements. The ability to swallow large objects almost twice of their size. Heightened sensitivity of a small smell and taste. In snakes, my choice is Crotalinae, constantly anticipating an unexpected covert attack. Therefore, need to be vigilant always on one hand and launching a sudden hidden assault on the opponents. Clairvoyants, they are more social than elapids. Elapids are not so social. My choice was Crotalus horridus, strong feeling as if someone is behind him or that he is surrounded by enemies, which in turn results in a preponderating and constant fearful state. It directs to this remedy. I had given her Crotalus horridus 200 2 times 2 days. Within a week, discharge stopped. But she wanted medicine for her headache, IBS, and 6 months I gave. Then once all those physical symptoms were better, she wanted for her discharge, depression. So now she is completely out of allopathic drug for all her complaints. So this is a case.
Don't know how to zoom out. Thank you very much, Jyoti. It was very beautiful
Welcome.
case. You didn't say us more about you. But
Yeah,
okay,
yeah.
the next speaker. If you have any questions to Dr. Jyoti, you can ask. If not, the next speaker. It was very interesting case, really. Someone is asking about repetition.
I had given once in 15 days, 2 times 2 days. Only 200. I did not go to 1M.
Okay, thank you. brief understanding of other families of snakes, someone is asking, but we will have more snakes in next presentation. So Niharika and me will also talk about snakes. But Dr. Jyoti, you can give brief understanding of any other snakes. See, we will do some seminar only about snakes after that, because this is huge team. We cannot cover the whole team of snakes or mammals or whatever, but we will enlighten you of all these areas as much as we can. So Niharika, I have to make you co-host. Our next speaker is Niharika. She's a young student, but very passionate in homeopathy, very good homeopath. She's also student of Dr. Shankaran, Goran Gekut. Wait, Niharika. Oops. I lost you, Niharika. I've just made you co-host, so now you can probably share presentation and your video. The remedy was Crutaeus horridus. Because of this feeling of sudden dread is coming, because of blood was affected, you know, the stomach and bleeding, you know, the viperi, the arrow, their pathology is more connected with the blood disorganization. Instead of LAP, they are more, in LAP, the nervous system is more affected, but it depends on the particular technique. But in general, that is the major difference between both. So very glad to see you, Niharika. Thank you that you are here with us. I like to see your smile and enthusiasm.
Thank you very much, and I am very grateful.
And looking forward to hear your lecture.
Definitely. Will I start?
Who you are? Okay, you can start. Then you can tell about you.
So, good evening to all of you. I am very grateful for this part of awesome event. Again, part 2. So the first event in part 1 is Jungle, Water, Sky. This is the continuation of this part 1. So here we again go. This is my discussion overview. What topic which I have to cover in this total discussion? Quick review of snake, proving in homeopathy, zoological characteristic in habitat, summaries of reptile, case of the old pioneers, theme of lachesis, and doctrine of signatures, personality of lachesis, and characteristic physical guiding symptoms. So these all points we have to will cover in upcoming during discussion in the 30 and 40 minutes. And first, I want to give the gratitude for my gurus, especially Dr. Samuel Hahnemann, the father of homeopathy, respected Dr. Rajan Sankaran sir, and respected Dr. Goran Gaikwad sir. I'm very thankful to both of person. They have to just taught me us lot of things. And first, I want to start with a last lecture quick review and recap. Whenever we have to seen any web series or any movie or any kind of serials, so we have to want 5 minutes quick review what we covered in the last lecture. So I want to tell you issues found in the animal cases, mostly which issue found in the animal cases. So the first and foremost is the issue of survival. This is a very common. They have a lot of issue with the survival, threat to life. They can also be the deceitful, malicious, and aggressive. And they will kill me, cut me, bite me, wrap me off, tear me apart. So whenever you have to just convert the patient version, so they usually use those things and those words during the conversation in the case taking interview. they kill me, that's cut me, that's bite me.
Niharika, Niharika, something happened. We lost you. Probably your connection. Something happened. Oh, it came. Niharika, we lost you. Where are you? I will probably stop live stream in YouTube.